Hi everyone, I'm Nina. Welcome back to the Mexicali Bariatric Center YouTube channel. Today I would like to talk to you about revisions, specifically revisions for lap bands. There are many reasons why somebody would want to have a possible revision from their lap band. Usually it's lack of weight loss, weight regain, or sometimes they start having actual technical problems with their bands, like the fills, the port, things like that. So let me tell you what we can offer. These are options that we offer our patients. We are a revision center. We have doctors specializing in revision surgeries. And these are the ones that we recommend the most, the ones that we think are the most effective. Well, let me first tell you what it is that we no longer do, because we found out that it was not very effective in the long run for our patients. We are no longer relocating bands. If somebody has a slip band, years ago we used to go in and put the band back in place and stitch it back where it was supposed to be. And but invariably, over 90% of the time, the band would slip again and eventually would have to be removed. So we were seeing that was not even a short-term solution. Like I said, sometimes in under a year, patients had to have it removed. Another thing that we would be doing was when somebody had the band removed and they wanted another lap band, we would go ahead and place another lap band, sometimes a larger band, sometimes a newer band. But again, the results were not very good. Again, in a short to medium term, it would have to be removed. Now, we don't feel comfortable with that. The options that we recommend, that we know are long-term solutions, are revising from your lap band to a sleeve, from a lap band to a DS or to a gastric bypass. Now I want to say that we do all these revisions laparoscopically, and we do them in a single procedure. There's no need to have two procedures done to have the revision. The only reason why we have not been able to do a revision in one step is in the case of an eroded band. In those cases of an erosion, the protocol we follow is that we remove the band, let the stomach heal for 6 months, preferably up to a year, and then patients can start considering another weight loss surgery. Again, the ones that would be a good option are sleeve, bypass, or DS. Certainly the risks are higher with certain procedures, even after a year, but it can be done. You evaluate risk, cost, what the patient needs, and then you move forward. But they can be done. We've done all of them. Now, having said that, the others, not eroded bands, even slip bands, or for other technical reasons they may be having, we do them 100% of the time in a single procedure. If you are finding that they're telling you that there's a 30% chance or 50% chance of not having it done in one surgery, one step, you might consider going to a revision center where doctors are more experienced in revision surgeries. It's not the same thing to do a first-time surgery than to do a revision. We have been doing them for a very long time, and revisions from lap bands are the ones that we do the most. So to start off with the revision from band to sleeve, it is some doctors, some surgeons recommend that if you have already failed at a restrictive procedure, like the lap band, to not go to another restrictive procedure, like the gastric sleeve. They would encourage you to go to a malabsorptive procedure, which is, it's very valid, but there are many, many patients that, even though they failed with the band, they do very, very well with the sleeve. A lot of people do. So when patients contact us and they want us to decide for them or tell them what to do, we don't like to do that. We can make recommendations, and we encourage people our patients to analyze why their band didn't work for them. If you had lost weight, let's say you lost 100 pounds, 150, we have patients that even lost 200 pounds with the band, and then you started having technical problems, let's say your port, or you have a leak in your port and you're not getting a proper fill, or suddenly you're too tight and then too loose when you get an unfilled, and you just can get to that point and you're starting to regain weight, then you can see, or you can conclude that just cutting portions is enough for you. If you limit your food intake, that is enough to help you lose weight. So then a restrictive procedure would be a very good option. If you're someone that working with their band and following the guidelines, now it's very important to be very honest, moving on, were you following the guidelines? Were you exercising, your protein, not drinking with your meals and things like that? If you were following the guidelines and you still didn't do well, or you lost 50 pounds and then got stuck and then just didn't move forward, you didn't gain but you didn't lose, then most likely another restrictive procedure will not be very helpful. You most likely need a malabsorptive procedure. This is the type of questions we encourage people to make, our patients that contact us, to determine which is the revision they should be looking for. So again, going for the sleeve, for anybody that they feel that restriction is enough, that just cutting portions and limiting how much you can eat is enough, then a sleeve is very likely a very good procedure for you. Now, you need to have a good, effective sleeve. We redo many sleeves, so we know that some sleeves are done very regularly, some sleeves are very big. So, again, have it done at a place where they know how to do revision surgeries. It's not the same thing. Sometimes we find that they just go around all the band scar tissue, so patients end with a big bulge on the top, which holds a lot of food. I think we can do a whole other video on how to do a proper revision. But if you have a revision surgeon, you most likely will have a good sleeve. And if you have a good tight sleeve done, then it should be enough for you. Now, there are some other patients that they already know that cutting portions is not enough. Sometimes when we go over what they have been eating, it really isn't very much. And we analyze, how many calories a day, how much they're exercising and things like that. And it's very obvious that they need something else. It's just the way people are. Some patients do need the help of the malabsorption. And the good thing is there are options. The options are, like I said, the gastric bypass or the gastric or the DS, the duodenal switch. Either of those are very good options. It can safely be done again in one procedure. We do them all laparoscopic. You don't have to have multiple procedures done, unless again an eroded band. So these are the options that we're offering. We don't offer revision to plication. We, again, don't believe it's a good long-term solution. So the ones that I mentioned are the ones that we truly believe will help you lose the weight, keep it off, and be successful on your weight loss journey. I hope this helps. If you have any questions, feel free to send them on the comments section of the video. Email us with questions you might have. And that's it. I hope to see you soon. Bye-bye.